Hi guys. Hello, good evening. Hello, good evening, good evening. Good evening. How are you guys? How are you guys? I am good. I am doing well. Actually, I forgot that you're not supposed to be wearing green uh in I am actually wearing green. And you should not be wearing green with the green screen or you'll disappear. So this is not mine, this is Ashish's. And while I was wearing this, I just kind of, what do you say, I disappeared when I was wearing this. So I don't know if you can see, I'm disappearing because I'm wearing green. So I had to put this and then put my hair in the front. Yeah, I'm so sorry. I'm so sorry. I'm so sorry. That's why I wore this. Okay. And I kept my hair in the front. So I'm sorry for the floating head and the creepy vibes. I forgot. I forgot you're not supposed to wear green with the background. Yeah. So I wore this is Ashish sir's actually. So I wore that. Okay. See, the PYQ, the only problem that the PYQ had was in the first part, the first paper. The rest papers are fine. So we will finish this part, okay? We'll finish this today, the leftover part, and like we'll continue with. You can go through the other two papers, all right? Because they're all fine. ठीक है? राम राम शंकर किस चीज का? Okay. So should we start? Yeah, should we start? Should we start? Just give me 1 minute. Let's start. Okay, so we were in biochemistry, right? So let's start with the first question. Okay, so can you tell me the answer for the first question? Can you tell me the answer for the first question? A 4-month-old child presents with complaints of refusal to suck breast milk. Further work reveals hypoglycemia, ketosis, and smell of burnt sugar. So there shouldn't be any issue in solving this question because it's a very, very simple question, right? क्योंकि उन लोग directly आपको बोल रहे हैं about the burnt sugar smell. So that is very like it's taking you towards maple syrup urine disease, and the defect in that is branch chain keto alpha keto acid dehydrogenase. Let's go to the next question. Okay, and phenylalanine, you know, right? There is mousy odor in this. Okay, there is mousy odor in phenylalanine. All right. Let's go to the next question. An 8-month-old child presents with hypoglycemia in between feeding. On examination, there was hepatomegaly and liver was palpable. The child presents with lactic acid, doses, ketosis, xanthomas, on the buttocks. So what is the most likely? Can you tell me what is the most likely deficiency in this one? Can you tell me what is the most likely deficiency? So basically they are pointing towards, they said that in the exam, they said that they specified that this was von Gerke's disease. Okay? So they said in the exam. So this becomes even more easy, and the answer is glucose 6-phosphatase, right? That's the enzyme. So make sure to go through your enzymes, okay? every year one question from this comes, so make sure to go through them. And look at the next question. Transport of neutral amino acid through membranes of the intestine, your kidney and liver is mediated by. ये बता दो अभी. It is mediated by your आंसर दिया था आपको यहाँ पे. It is mediated by your Mester's cycle. Okay, they basically play a very big role in this. ठीक है, so they transport neutral amino acids, and this was actually a NEET PG question. It was not an FMG, so I am going to remove this question. ठीक है, this question did not come for the exam. It was a NEET PG question, but I was like, let's add it to this, right? Let's go to the next question. Leach-Nyhan syndrome is reported due to enzyme defect of. Again, this is a very important topic. They ask about this. ठीक है? Actually, my voice has become very, what do you say? I don't know, because I have been continuously sick. I'm so sorry regarding my voice. Okay, it's not getting better. I don't know what to do. And yesterday I was even vomiting, so I'm sorry about that. Yes, this is your hypoxanthine guanine phosphoribosyl transferase. ठीक है? That is the answer. Yeah, I'm so sorry. So sorry about my voice. Okay, I cannot help it. I'm drinking hot waters. So remember, this is a defect in your purine metabolism. ठीक है? This is a defect in your purine metabolism, and the one image that they usually put in this question is that this child, right, there is mental intellectual disability, and this child has a thing where they mutate themselves. So what they do is they take their fingers and they started biting it. Okay, so they get ulcerations and bite marks on the fingers. Okay, so please. Yeah, so that is one point that is very important, and that image has come in our exam. Self-mutilation, the biting of fingers, okay? So that is very important, all right? And this is due to this defect. Let's go to the next question. Which of the following protein does not have a quaternary structure? Which of the following proteins does not have a quaternary structure? Your hemoglobin, collagen, insulin, they all have a quaternary structure. Your myoglobin has a tertiary structure. Okay, it has a tertiary structure. So the answer is D. Okay, it is D. It is myoglobin. It has a tertiary structure, 3. All right. Now look at this. A boy presents with the stretchable skin and flexible fingers, which he can reach his forearms following. What is the most likely condition? What about this? मुझे माफ कर दो. Actually, मैं चाहती हूँ कि I take better classes with better voice and with better jokes and with clothes that don't make me look scary. But I'm so sorry. I'm not getting better. I'm not able to help it. I'm trying. I always have Vicks or something with me, and I'm taking Clofsil, and I'm drinking hot water, and I'm taking steam, but I'm not getting better. Maybe it's Delhi. Delhi is very polluted. So हम South वाले used to है good air की, so I don't know, maybe because of that. ठीक है, तो the answer of this is Ehlers-Danlos syndrome. Okay, this is very important for the exam. Okay, so this is your, and it is a type 4 collagen defect. This has been asked. Type 4 collagen defect. They ask you what kind of collagen has a defect in this. ठीक है? Do it. I'll go get it checked after your exam. Okay. And this question, I actually discussed it before. The fibrous capsule. Okay. They actually said fibrocapsular cartilage or something. And since cartilage comes in, hyaline cartilage comes in type 2, many people actually confused it with type 2. But remember, this is not type 2. Okay, fibrocartilage plus your bone plus your fibrocartilage, it is in type 1. ठीक है, it is type 1. Type 1. कहाँ पे टाइप 5 लिखा हुआ है? एक्सप्लेनेशन तो यहाँ पर है, टाइप 1 है. ओके, दिस इज टाइप 1 where I can see the explanation, right? It is saying type 1 in this. ठीक है, so this is type 1. What about the next question? Look at this. A 28-year-old male had undergone surgery where wound debridement was performed, but the wound was not healing. Most important vitamin deficiency in playing a role in delay in wound deficiency. Wound healing is अच्छा, अगर यहाँ पे टाइप 5 लिखा हुआ है, आई एम टेलिंग यू, राइट, आई एम करेक्टिंग द पॉइंट्स विच आर मिस्ड, राइट? ठीक है, आई एम करेक्टिंग इट, राइट? सो डोंट वरी. ओके, अब ये देख लो. अच्छा, मेरी पारस. ओके, so in this, remember your vitamin C, your ACE, right? They are your ACE क्या होते हैं? ACE are your antioxidants, okay? So firstly, your vitamin C is important in free radical, preventing you from free radical injury. So that will increase wound healing. The other thing is it does collagen synthesis, ठीक है? It does collagen. It is needed for collagen synthesis. So both of this combined, they increase wound healing. All right? They increase wound healing. Yes, Dr. SF. Yes. Now the next question. Look at the next question. Which of plays in increasing in iron absorption? I don't need to ask you this. This is vitamin C. So your vitamin C is used in increasing the absorption of iron. All right? Then look at this question. A 40-year-old male presented with edema around the metatarsal bone. Workup reveals hyperuricemia. What's the most important enzyme that plays a major role in causing this? What is the major role? Who plays the major role? It is your xanthine oxidase. ठीक है? Xanthine oxidase, this is pointing towards gout, right? And they are also telling about increase in uric acid. Can you tell me one drug that stops this, inhibits this? That's your allopurinol. ठीक है? That inhibits, right? That inhibits, right? Yes, very good, guys, very good. Now look at the next question. A chronic alcoholic presents to clinic with generalized weakness and lethargy. He was also telling stories. Again, this is a very, very easy question. Whenever alcoholic is given, remember they are really trying to ask you about vitamin B. Which one are they trying to ask about? They're trying to ask about vitamin B1, okay? This is definitely Wernicke's encephalopathy. Okay? See, neurological disorders, if I'm talking about vitamin B2, yeah, neurological disorders are there. Neurological plus what else? There is anemia. Is there any mention of anemia here? That should rule out vitamin B12, right? Neurological disorders plus anemia should be there. But anemia is not there, so you can rule that out, right? So this is a clear-cut case of Wernicke's encephalopathy, okay? There is global confusion, nystagmus and ataxia, and it's a classical triad. ठीक है? गोवा, हाँ, गोवा, जो गोवा का triad बनता था. Now look at this. This next question, again, these questions have been repeated so many times. और vitamin से 2-3 question हमेशा हर साल आते हैं. Okay, हर साल आते हैं. A 40-year-old male presented to the OPD with we are done with this, right? Yeah. OPD with complaints of lethargy, weakness, and shortness of breath. Why are these points important? Lethargy, weakness, and shortness of breath, because these are pointing towards anemia. Okay, they are pointing towards anemia. Plus, his routine investigation reveal homocysteine levels. So homocysteine levels are increased by your B6, 9, and 12. B12. But if this was B12 deficiency, then methylmalonine would have increased. So this is normal methylmalonine. Okay, plus anemia is present, so this cannot be B6 deficiency. So all gone, B12 is gone, this is definitely folic acid. ठीक है, समझ गए, ये समझ गए? You understood this? You understood this? Your homocysteine levels are increased by 3, okay? They are increased by 3. Out of them, anemia is present in B9 and B12. So B6 is out. Plus, no, okay. So this lethargy, weakness, and shortness of breath shows you that this patient has anemia. इसको anemia हो गया, और anemia बस B9 and B12 कराता है. तो B6 is out because homocystinuria are caused by these 3. Now, the other thing they said is methylmalonine is normal, but in the case of B12, methylmalonine increases. ठीक है? So that it is not B12 then. So folic acid is left, right? So abhi, let's go to the next question. Wilson's disease again. This is a very easy question. It is ATP7B. What is ATP7A? Can you tell me ATP7A? Neurological symptoms are also seen. Yes, they are also seen in B12. Okay, understood, right? अभी मुझे ये बता दो. ATP7A. ATP7A. Can you tell me about ATP7A? Menkes, very good. Menkes disease is your ATP7A. Menkes disease. Menkes disease. Okay. Pierce view and Waters view, I've told you about it before. Pierce view is with open mouth, like it is like this. Okay? And your Waters view is the same view with closed mouth. Okay? It's closed. It's closed. Okay? So like this with closed mouth, it is Waters view. Then you open it, then it is this thing. All right? So that's the only difference. Then look at the 14th answer. A 73-year-old woman comes to the physician because of a 2-month history of diffuse weakness and tingling of her arms and legs. Neurological examination shows the weakness of the extensor and flex or muscles of the lower extremities. Sensation of vibration. Now you can see there are neurological symptoms. Okay, neurological symptoms are there. Plus, they are asking about a deficiency here. Okay? I am going to send the PDF with all the first paper corrections. Okay? Raveen. Alright? So the answer to this is B12. Okay? These are symptoms of subacute degeneration of cord. Okay? Subacute degeneration of cord. Now look at the next question. In xeroderma pigmentosa, the type of DNA repair defect is the type of DNA. Which one is it? It is nucleotide excision repair. Okay, this is a direct one-liner. Nucleotide excision repair. Now look at the next question. A 25-year-old female presents to the medicine OPD with acute abdominal pain for which exploratory laparotomy was done. He is also accompanied by neuropsychiatric symptoms, and the urine collected turns to black in room temperature. Which one is this? This is a proper classical picture of, which one is this? Which one is this? Everybody? This is your acute intermittent porphyria. So I've put it here. See, they present with pain in abdomen, right? And they present with neuropsychiatric symptoms, okay? Psychologic symptoms. Plus, there is a change in the urine. All these are features of your acute intermittent porphyria. Okay? They are all features of your acute intermittent porphyria. Now look at this. Storage form of neutral lipids is. What is the storage form? How do we store them? How do we store your lipids? How do we store your lipids? Very good. They are stored in the form of triglycerides. They are stored in the form of triglyceride. Okay, can you tell me where else we get black? Urine turns black on long standing. Very good, amazingly elder. Amazing elderly. Why is your name amazing elderly? Very good. It is seen in alkaptonuria plus one more. In some anemia also it is there. In some anemia also it is there. Can you tell me in which anemia? It is there in an anemia also. Urine turns dark. Alkaptonuria, it is there. One more place where it is dark. A 25-year-old male presents with okay. A 25-year-old male presents with hypercholesteremia and increased risk of heart disease. His elder brother also had similar findings and succumbed to this. What is this? Congenital LDL receptor deficiency. Sorry. Yeah, this is primary familial hypercholesteremia. It is a congenital LDL receptor deficiency. Okay, it is a congenital LDL receptor deficiency. Now, which of the following is a cofactor? Please tell me which of the following is a cofactor for glutathione peroxidase. Dr. Reddy, thank you so much. Very good. Can you tell me what happens if this is if there is a defect in this? So many questions related to this, right? Plus selenium, you know there is Kishan's disease, right? Copper, you have Wilson's. In zinc, you have acro. In zinc, you have which one? Tell me about zinc. Very good. Tell me about zinc. Zinc में क्या है? Acrodermal enteropathica. Very good, very good. And then if you have a defect in this, then you have G6PD, right? Because this is there in the RBC. Okay? And what does this do? It changes H2O2 to H2O2 plus water plus O2. Okay? And it uses selenium. Okay? Your glutathione peroxidase. It is with the help of selenium, it does this. So if this is not there, then oxidative stress will cause RBCs to lyse. Okay? And G6PD happens, right? So many questions, so many answers related to this question. And I like this question. It's a very good question. ठीक है? तो इसका आंसर selenium है. You get it? How many questions could be made out of this alone? Right? Chalo, let's go to the next question. A 35-year-old male returns to India. We don't need to do this. This is RT-PCR. China बोल दिया तो RT-PCR ही करेंगे. Then look at this. Marasmus is reported in Indian children mainly due to so in kwashiorkor, kwashiorkor plus marasmus. Both are protein deficiency. Okay, both happen due to protein deficiencies because they come in that. But marasmus also has calorie intake. With protein, it also has less in calorie intake. Okay, less in calorie intake. That's why, yeah, energy is deficit. Protein plus energy. So the answer is B. This is a protein energy malnutrition. Okay, so they did not specify calories here. Calories are not given, so the next best thing to choose is protein. All right. Both marasmus and kwashiorkor are protein energy malnutrition. Okay, both of them. But kwashiorkor mainly for proteins and your marasmus for energy intake. Protein plus energy intake. ठीक है? All right. So this question was given last year, right? And there are only 4 options in this. If calorie intake was given here, you would choose calorie intake. Okay? If calorie intake was given here, definitely you would choose calorie intake. But that was not given, that's why it is protein. All right? Okay, let's go to the next question. A 45-year-old male worker in an MNC presents to the OPD after a routine annual checkup with HbA1c of more than 6.5 for the first time in years. What is the status of this patient? What is the status of this patient? Always remember your HbA1c, HbA1c is very specific. So if it is more than 6.5, you can already tag them as diabetic. Okay? If it is more than 6.5, you can already tag them as diabetics. All right? Now look at the next question. Look at the next question. It is a psychiatric question. A 25-year-old male presents with symptoms of anxiety and loneliness and was diagnosed with depression. He is to be prescribed with a medication which is a serotonin norepinephrine reuptake inhibitor. Identify the drug. Yes, very good, Khushbu, very good. It is, okay, yeah, very good. So, what is the answer? It is B. We have done this before. It is B. Your first one is an SSRI. This is a MAO inhibitor. Okay. Let's go to the next question. A 28-year-old mother was diagnosed with mild depression. She has a 3-month-old child. Which among the following therapies should be prescribed? So, which among the following? See, she has a 3-month-old child and you're supposed to be exclusively breastfeeding for 6 months, right? You're supposed to be exclusively breastfeeding for 6 months. So you generally don't give them any antidepressants. Okay, you don't give them antidepressants because if anything passes, it passes to the baby also with the blood. So for them, we do cognitive behavior therapy. Okay. For them, we do, yeah, postpartum blues. Very good, very good. And this is mild depression. So you just do cognitive behavior therapy. Okay, let's go to the next question. See, this is why I'm not able to take proper classes. It's very hard for me to talk right now. I'm finding it very difficult. And that's why I had to cancel the class yesterday. But I wanted to finish this before I say goodbye to you guys. So, it's okay. Let them be anywhere. See, I don't have, you can join, you can watch it later. Somebody told me that my voice looks very beautiful at 2x speed. It goes like, so some people enjoy that also. So it's good. Okay, remember that when there is panic attack, right? That patient is the patient is very, what do you say, the patient is feeling anxious and they have a feeling of impending doom, okay? They feel like everything will, like they're scared to die. They feel like somebody would kill them, or they cannot breathe, they have sweating, they have palpitations, they have tremors, but they will not have suicidal thoughts. This is a sign of depression. Okay, suicidal thoughts come in depression. They do not come in this thing, panic attack. अरे यार सब कुछ कर लिया, हनी टस का सिरप, हनी टस का काढ़ा, ginger काढ़ा, then ginger water, then coffee, then all cold, hot, everything. I've done everything. ठीक है? We love you too. Okay. So let's go to the next question. Which among the following deficiency is the reason for cognitive impairment in the old age? So this is a very, what do you say? Again, an easy question. ऐसे क्वेश्चन आ जाएंगे तो मेरे बच्चे तो टॉप करेंगे, because neurological problems इसमें किसमें होते हैं, ये किसमें होते हैं? These are in B12, subacute degeneration of cord. Yeah, maybe my voice needs rest. I'll rest after your exam. I will definitely rest. Now it's okay now. It's okay. A chronic alcoholic patient suddenly withdrew his alcohol consumption. Later he developed tumor global. Again, these are very, very direct questions, right? And also alcohol. So this is definitely pointing towards Wernicke's encephalopathy, and you give them thiamine. Okay, you give them thiamine. You give them thiamine. You give them thiamine. Okay, you give them thiamine. In the paper it is written as A. Please correct it. It's B. Okay, it's B. Anyway, I will be correcting them and sending it to you, right? So this is Wernicke's encephalopathy. Now look at this. Earliest symptom of alcohol withdrawal, or even smoking. Put smoking here. So what is the earliest symptom? हाथ कांपने लगते हैं, ठीक है, ऐसे ऐसे होते हैं. अगर एक बूंद अंदर ना जाए तो हाथ कांपने लग जाते हैं, like your hands will be like, ठीक है. तो क्या होता है? सबसे पहला सिम्टम, in around 6 to 8 hours you will be like, यार एक पैक मिल जाती तो, ठीक है. तो this is in the first one is the earliest symptom. It is tremors, ठीक है, it is tremors. All right. Now this we have done. Lithium causes Epstein anomaly, and what kind of heart shape is seen in this? Box shaped is seen, right? Box shaped heart is seen, right? Am I right? मैं सही हूँ? What about this? Yeah, very good. In a child, which of the following grips appear first? In a child, which of the following appears first? Very good, guys. Very good. You know what happened? I changed my shampoo and suddenly my hair looks very beautiful. Yeah. So, see, it is a very logical answer. First, you learn to hold it, right? First, you learn to hold the pen. Then only you would be writing with it, or then only you can transfer it from one side to second. So this is, you don't even need to learn much to answer this. This is very logical. So in FMG exam, in our FMG exam, if you are logical, if your logical reasonings are good, then you can clear the exam. Okay, you can definitely clear the exam, because some of the questions are very logical and you can just eliminate the options because of this. You can keep eliminating the options based on how you can, logically separate those, right? Yeah, thank you, thank you. पार्लर के पैसे बच गए. या पार्लर के पैसे, you know, when I fractured my arm, I spent so much money just to go get my hair washed because I cannot wash my hair with two hands. So now look at this. See, the tips that I will give you, the tips that I can give you for the exam, देखो, make it a 50-50. Okay, four options are there. Four options are there, right? Try to eliminate two options, and it's easy to eliminate two options. हर एग्जाम में दो ऑप्शन निकल जाते हैं. दो ऑप्शंस मतलब दे आर बैड. ओके, they can be eliminated easily. So give yourself a 50-50 chance. Now in that 50-50, out of 300 questions, can't you get 150? Logically you should. If you get 150 wrong, you will get 150 right. So you will pass. You will clear the exam. See, logically I can tell that you can pass. ठीक है? So every question you have to eliminate two options and then you will definitely pass. ठीक है? समझ गए? You will pass. इतना simple था. पढ़ाई क्यों कर रहे हो? Okay. So now look at this. We have done this before. The answer for this is ibuprofen because we use endomethacin as well, but endomethacin has side effects and those can be avoided in your ibuprofen. ठीक है? Those can be avoided in your ibuprofen. Just remember, make sure that you eliminate options. Read the question carefully. Many times what happens is you will make silly mistakes. Silly mistakes आप करोगे किस चीज की वजह से? By being overconfident. Now tell me one thing, okay? मैं आपसे सर्जरी का एक क्वेश्चन पूछूंगी. सर्जरी में there is a 67-year-old man, okay, 67-year-old man, and he is binge drinking कर रहा है, and there suddenly he has pneumomediastinum. ठीक है? So what these three things, they point towards what diagnosis? Can you tell me? Can you tell me what does it point towards? Bore-Harvey, right? It points towards Bore-Harvey. But some people, because binge drinking is also seen in Mallory-Weiss-Stare. Okay, it is seen in Mallory-Weiss-Stare. So many people were like if you have both the options, you will be like, if you had only remembered कि Mallory-Weiss-Stare में binge drinking होती है, then you will not be able to solve it properly. So don't, just because you associated one word with the diagnosis does not mean कि वो diagnosis है. Read the question properly. Age देखो. Many times age tells you a lot. Okay? What if I give you a case about breast and I put a 20-year-old or 25-year-old female, which is the first diagnosis that you can make in breast with just the age? Which kind of benign tumor am I talking about in breast? Yes, I'm talking about fibroadenoma. So just looking at the age, many questions get solved, especially clinical questions. So don't avoid the age. Plus be careful with what you are, how you're reading the question. In my exam, there was a picture of a gametocyte of an RBC with a banana shaped gametocyte. Okay, and this is, what is this banana shaped gametocyte in your RBC? This is your falciparum, right? I got this wrong in my exam. In my exam, what I did was I chose it as falciparum. Then last minute I changed it to malaria. I was like, नहीं शायद मैंने malaria में पढ़ा है. In the beginning I was right. Like that I did for 11 questions and all of them were wrong for me. So can you understand? Don't change your answers again. You will not change your answers. एक डाल दिया वो डाल दिया. Because there's a higher probability to mark the wrong answer than the right answer. आई डिड इट फॉर माई एग्जाम, ठीक है. इतने छोटे छोटे क्वेश्चंस, यू नो, आई कुड हैव स्कोर्ड अ बेटर स्कोर, पर आई मार्क्ड इट रॉन्ग because I started overthinking. That will happen in your exam. So what can you do? What you can do is, you firstly एग्जाम देना है, ठीक है. एग्जाम देना है क्योंकि आपने पे किया है, आपने 6,500 पे किया है, और ये पैसे वेस्ट नहीं करना है, ठीक है. 6,500 बड़ी बात होती है. सोचो, एक FNG एग्जाम के लिए इतने पैसे मांग रहे हैं. कोई ऐसा एग्जाम नहीं है जो इससे इतने ज्यादा पैसे लेता है, ठीक है. तो इतने पैसे दे चुके हो तो एग्जाम तो देना ही है. There is no need to get scared about that. The second thing is, when you go inside, don't get overconfident. कुछ बहुत simple questions दिखेंगे. Sometimes what happens is, in a line you will see at least 10 questions which are all wrong, and you will feel demotivated. But I'm telling you, even in our paper, in anatomy, one-liners were given. If you don't know them, you don't know them. But after that, the paper became very good. I wanted you to see this in the mock test, that sometimes wrong questions can come together. But what you can do, you stay motivated कि नहीं यार, एग्जाम तो अच्छा ही जाना है, एग्जाम तो अच्छा ही जाना है. चलो, ये एक क्वेश्चन नहीं पता है, मुझे 299 थोड़े लाना है, मुझे 300 नहीं लाना है, मुझे 150 लाना है. तो एक क्वेश्चन नहीं पता है तो इट्स ओके, I'll get to know the next question. So be very positive when you're in the exam. Okay, be very positive in the exam. Oh yeah, it's 7,000. Okay, it was 6,500 in my exam. तो देखा, हर साल जो बढ़ रहे हैं आपके पैसे, देखा आपने देखा कैसे लूटते हैं हमें, ठीक है. तो उनको मौका मत दो फिर से लूटने का. हमें पढ़ो, आप अच्छे से जाओ. Please, please, please stay motivated, and please give the exam with a very calm mind. Don't let your emotions get over you, ठीक है. हम आपके साथ है ना, हम हैं ना आपके साथ. You tell us what issues you are having and we will take care of it, ठीक है. अभी let's go to the next question. तो ये इसमें जो भी questions थे ना, we have already discussed this, ठीक है. We have already discussed this. What is this? What is this image? What about this? What image is this? This is used in CTEV, right? And what is this? What is this? What is this? क्या है ये? This is a Dennis Brown splint, okay? This is your Dennis Brown splint, and it is used in CTEV, okay? And look at this. What is this? I don't want you to look at the question. It is a very, very, very good, like, direct looking at this, you can get it. If you want, I can discuss those questions. Bull neck appearance. There was a girl with her neck bulging out, okay? There was a swelling on the neck. So that was seen in diphtheria. Other thing that you can see in diphtheria is a pseudomembrane. Okay, pseudomembrane, Chinese letter pattern. These are very important in diphtheria. Then most common cause of inspiratory stridor, it is laryngomalacia, and you see omega shaped epiglottis in this. Okay, and what is the management? What is the management in this? You do conservative treatment. It is self-limiting. It gets okay in 2 years by its own. Then thumb sign, you know, that's the sign on X-ray. It was there in your mock exam as well. And the other sign that you see is steeple sign. Where do you see steeple sign? Can you tell me, where do you see steeple sign? Steeple sign. Steeple sign बता दो मुझे कहाँ दिखता है. Croup. Very good. It is seen in your croup. ठीक है. First to appear, this is a direct one-liner. ठीक है. और burnt sugar smell, ये तो अभी किया है हमने. ठीक है. Then this is the soap appearance. I think you already gave the answers for this. Okay. I think you gave the answer for this. क्या था इसका आंसर? क्या था इसका आंसर? This is soap bubble appearance, right? Soap bubble appearance. Can you see? It has a soapy bubble appearance. This is seen in your giant cell tumor. Okay. ऑर्थो से क्या पूछते हैं? ऑर्थो से पहले तो फर्स्ट फ्रैक्चर्स पूछते हैं. फ्रैक्चर्स प्लस दे आस्क यू अबाउट Ewing sarcoma, plus osteosarcoma. That's a very favorite question. It came in my exam as well. मैं ऑर्थो छोड़ के गई थी, डोंट मेक दैट मिस्टेक. 5 मार्क है, बट सी रेडियो एंड ऑर्थो कैन बी कंबाइंड टू मेक 10 मार्क्स. मेरे एग्जाम में अ लॉट ऑफ questions came from radio and this thing. Yeah, so your Monteggia Galeazzi, your Colles, plus your green stick fracture, all these are very important. फिर आपका osteosarcoma, osteo-Ewing sarcoma, then your Brody's abscess, all these are very common questions that are. Then the most common bone that is fractured in your wrist, that's your scaphoid. ठीक है, scaphoid. All these are very common questions to ask in this thing. ठीक है, very common questions to ask. Plus this question was not asked for us, nor will it be asked. ठीक है, पर इसका आंसर लेट है. Okay, look at this. This is, what is this? What is this? A patient from Bihar presents with teeth damage. Look at this. What is this? This is actually this is fluorosis. This is fluorosis. So due to excessive fluoride, right? Due to excessive fluoride, there is fluorosis. So what happens? The bones, right? They get denser. This is actually osteosclerosis. It leads to osteosclerosis. It leads to fluorosis, leads to osteosclerosis. ठीक है, so they become more what do you say, denser. All right, this is a classical picture of fluorosis. Okay, and it leads to osteosclerosis. Don't forget this. And the last question was an alcoholic patient slept with compression around his arm, like basically he drank and he slept like this. Which palsy is this? This palsy, keeping my hand like this. What kind of palsy is this? What kind of palsy is this? Okay, sorry, you can't see that, and now you can't see some part of me also. Yeah, it is Saturday night palsy. Okay, क्योंकि दारू तो Saturday night को ही पी जाती है, right? बाकी दिन तो हम पीते नहीं. Right, so which nerve is damaged in your Saturday night palsy? It is your radial nerve. ठीक है, it is your radial nerve. Honeymoon palsy कैसा यार? Okay, I can understand drinking and putting your hand behind. Honeymoon क्या मतलब करते, क्या मतलब, I don't get it. Okay, so we are ending with this paper. The paper of this is very good for December plus your FMG August. ठीक है, तो go through the papers. This one paper I will send the correction ASAP. Plus tomorrow you have the last image-based mock test. Okay, you have the last image-based mock test by NLC. ठीक है, it will be uploaded on the IL app, on your IL app. Plus tonight it is radial nerve. It is radial nerve. ठीक है, it is radial nerve. Now okay, so give the test. ठीक है, don't miss the image based mock test क्योंकि direct उससे questions आते हैं exam में. And best of luck for your exams. If you want me to take one more session, I can do that, or we will just end here. ठीक है, test is tomorrow at 5 PM, your image based mock test. ठीक है, अरे कितना अपलोड करे, टेल मी. आई एम नॉट स्लीपिंग. हम बहुत कुछ कर रहे हैं. प्लस वी गिव यू अ शेड्यूल फॉर द लास्ट डे, राइट? वी अपलोडेड अ लॉट ऑफ क्वेश्चंस ऑलरेडी. इससे ज़्यादा क्या करें, बोल दो हमें. हमने बहुत कुछ किया है. ठीक है, इफ़ यू वांट, ओके, ओबी गाइनी सेशन आई विल टेक वन ओबी गाइनी सेशन. प्लस एनीथिंग एल्स? एनीथिंग एल्स? Yes, there will be a quiz at 11:30 today. Okay, so I will take an OB-GYN session. ठीक है, OB-GYN में whatever important images are there, I'll do that. Plus और कुछ and patho I took. Okay, let me take a miscellaneous. 2 sessions more I will take. One miscellaneous, whatever I find important, I will share it. Plus 1 OB-GYN. ठीक है? Is that okay? ठीक है? चलेगा आपके लिए? चलेगा? Micro, I'm making a paper. See, what I'm trying to do is micro, I am making a paper and I will upload this on the IL and NLC app. You give the paper because the paper will be, and what do you say? Should I give the paper and discuss the paper? Will you give the paper on the app and I will discuss it? Is that okay? ठीक है? तो I'll do that. 4th December और August 14th आप देख लो, उसके explanations बहुत अच्छे हैं. June I discussed because the paper had some lacking things. We will not be able to cover both the papers. So you go through this paper and you take care of yourself. All of you keep studying. I love you guys. ठीक है? I'm feeling very what do you say? Happy for you guys that you're ending this and you will pass and not attend my sessions anymore. But I really wish the best for you. ठीक है? So keep studying. Keep studying. Keep studying. And Satvik Raj, can you text me on 9121782671? This is my number. मेरे भाई का नंबर मुझे याद नहीं है. ठीक है? You text me on this and I'll send you my brother's number. So take care of yourself. I love you guys. You take care. Okay, you guys take care and keep studying. Keep studying hard. ठीक है? I love you all. Make sure you give the mock test and all the tests. Okay, अब की बार 150 पार. ठीक है? अब की बार 150 पार. Take care guys. Bye.